Good health is about more than good health services. It's about the air we breathe, the work we do, the places we live, our relationships, and of course, the food we eat. The Institute of Environment, Health and Societies at Brunel University London is researching how common diseases are down to our environments and the way we lead our lives. Katie Haswell went to find out more.
People are living longer, but illnesses like heart disease, cancer and obesity are on the rise due to a broad range of environmental and lifestyle factors which affect our health and well-being in ways we're only just starting to understand.
These days we all get bombarded by conflicting information about how to stay healthy. What kind of things we should be eating, what kind of things we should be avoiding, what vitamins we should be taking, how to stay active. I don't know about you, but I find it all very confusing.
To make sense of it, the Institute of Environment, Health and Societies brings together 150 researchers from disciplines across Brunel University London to understand the complex factors that make us sick in the first place.
Our research is really about keeping people out of hospital, and that's both health and social care. Research on things like physical activity, reduction of smoking, also looking at the economic benefits of actually taking up those interventions. And then on the broader environmental side, it's actually out of the health sector, looking actually at the environmental sector and looking at environmental management.
One area the academics are focusing on is unravelling the complex barriers underlying physical inactivity.
I think people that are shy probably don't like to come to the gym because of working out in front of other people, but people don't take any notice.
I'm 15, we're in year 11 now. We don't do that much of activity in school, so we only have PE once a week or so we come to the gym to carry on the education.
We know that social inequalities really make it difficult for people to take part. So those people who are elderly, those people who are living in deprivation, people with disabilities, some groups of women and girls, for example. It's not because they're not motivated, it's because there are complex challenges that people face. We want to understand those, but more importantly, we want to challenge them and change them, to do something about it.
The Institute works with the public and helps community organisations tailor their health and wellbeing programmes.
We have a few Paralympic sports that we deliver, boccia and new age curling being like the indoor Winter Olympic sport, but an indoor version. And we're finding the over 60s are loving it. You know, it's something they can get involved with. It's not too complex, but actually they can get involved within their homes and within the centres.
Decision makers need to know if programmes are value for money, and the Institute's evidence is invaluable.
In the past, a lot of funding has gone into treatment, and the NHS is obviously investing a lot in treatment services for the population. As the evidence base is growing around the value of investing in preventative health services such as physical activity, there is much greater emphasis and investment in preventative health services. So it is research like this that Brunel are doing that really helps to build that evidence base and make that case for shifting from treatment to prevention.
The Institute's public health economics research shows that prevention is also cheaper than cure, like a project where GPs advise exercise.
We've showed that it costs actually less than £2,000 to get an extra year of full health in the population. When we roll out this program, which essentially involves the GP providing advice about people having to do physical activity, having to go to the gym to improve their levels of activity. And this is actually 7 times better than treatments that are offered through the NHS.
If governments are serious about reducing the cost of health services, they need to invest in research to identify preventable causes of disease.
There are a whole range of factors that we don't know very much at all about in terms of their impact on our health and well-being, because we simply haven't done the research. And a lot of the time that's because there hasn't been any investment in research in those areas. So there's a real need to do that, I think, to invest.